Now, what is fertility preservation? It's a fundamental issue for individuals of reproductive age or prepubescent girls and boys whose future fertility may be compromised. It is affected by age, genetic syndromes, treatments. Preservation is conducted in two parts: cryopreservation of gametes or gonadal tissue or to achieve a pregnancy. Why fertility preservation? More than 80% of the children and adolescents with cancer become long-term survivors, and it is better than diagnostic and treatment facilities. Gonadal failure resulting from these treatments may affect different aspects of reproductive health, pubertal development, hormone production, and sexual function. For whom is fertility preservation important? It can be done in malignant conditions and benign conditions, malignant conditions being more common. Malignant conditions, like all the cancers and the cancer related treatments, can actually damage the gonads, both in the male and the females. Most of the chemo and radiotherapy medicines are actually chemotherapy medicines, and the radiotherapies, especially the pelvic radiotherapies, are actually damaging to the gonads. So, these are the list of cancers. You can just pick out and write in the examination. You can just tell them that pelvic diseases, pelvic cancers are more dangerous. And benign conditions, you might be surprised why in a benign conditions we would survive, but there are certain conditions where there is a rapid decrease in the ovarian reserve. Inflammatory diseases, rheumatoid arthritis, pemphigus, hematopoietic stem cells, etc. And medical conditions causing POI, like altered hypothalamic pituitary gonadal axis, ovarian oophorytis, benign ovarian tumors, mosaic Turner syndrome, Fragile X syndrome, galactosemia, and male genetic disorders such as Klinefelter syndrome. And fertility issues in the cancer patients, the main effect arises from treatments such as chemotherapy, pelvic radiation, biological or targeted cancer therapies, and surgical pelvic interventions. The effect of chemo and radiotherapy on this, how it can actually, in the follicle state, it directly acts on the primordial follicles, and if there is no primordial follicles, obviously the follicles will not grow. An indirect action is by damage to the growing follicles, and it can damage the oocyte, and oocyte death can occur, and somatic cell death can occur. Okay, the effect of chemotherapeutic drugs on the female gonads depends on the drugs, dosage, duration of therapy, and the disease. Okay, the cyclophosphamide histologically shows complete absence of ovarian follicles with tumica, albuginia, and thickening. Alkylating agents are the most consistently associated with premature ovarian failure, mutagenesis, and teratogenesis. Cyclophosphamide can cause amenorrhea within a month of starting the therapy.